parks and public health. But for me, the most important part about public health is that we get to work together on projects that create conditions that promote health. And, your work is huge in that area. Your work is huge. And I'm going to talk a little bit about why parks are so central, but, the fact that you're even here on a beautiful night, coming to be together and to share each other's stories and the work that you're doing really speaks volumes about the commitment you have towards making sure that what we're building in the city is a place where every single person gets to live their life to their full potential, and parks play a huge role. So thank you for all your work, and certainly thank you to Ruth and her staff, and Christine and Valerie for all the support and leadership you've shown, across the city. Because, we can all get stuck working, not stuck, but, deeply embedded in working in our neighborhoods. But it is important that there are folks who are taking a broader vision and taking charge of bringing people together across the city and really thinking about what the collaboration is going to look like, what the integration can look like. So my hats off to the tremendous leadership we have in the room today. And also I want to thank, there are some staff here from the Boston Public Health Commission, and I want to acknowledge Ann McHugh is here, Karen Spiller is here, Mary Jane England. These are folks that I know you all know from your work, because they're actually the people from the health department who are deeply committed to supporting what's going on across the city in terms of improving people's access to opportunities for what we call active living. And then last, before I start, I want to just thank Tony. She has been a tremendously supportive partner of public health. I'm not actually going to talk about sugar-sweetened beverages tonight. I hope not. But, oftentimes, when you're running a large agency, and Tony has so much that she has to worry about, and, you have a sister agency that says, I think there's some work that you're doing in your department that's really related, and we need to work more closely, and working more closely really translates, honestly, to more work. It's working more closely, but we're always asking for more, and for more help, for more assistance, for more, collaboration, and that's all more work. And Tony has honestly never said no and never complained. And I wanted to thank her for that. It's a breath of fresh air, and it makes a tremendous difference to have strong partnerships. Because again, as I'm going to talk tonight, we as a public health department cannot create the conditions that promote health by ourselves. We can't do it without your help, and we can't do it without the help of people like Tony. So thank you so much, Tony. And I too live across the street on the other side of Franklin Park, so I call this my park. And I just think we've got such beautiful green space in this city, and Tony and her staff take very good care of our green space that is city property, and we're very lucky to have it. But I'm going to go ahead and get started. So I really wanted to start by, what do I mean when I talk about creating a healthy community? Because that's really what I think the fundamental work needs to be at public health departments across the country, not just in a city like Boston. I don't think public health is really about making sure people know about what vaccinations they need, or how to connect to a primary care doctor, or whether or not they need to get tested for a certain illness or disease. Or I don't even think it's about making sure people get screened. I think those are important, but I think the most important thing we have to do is create healthy communities. We have to prevent disease. That means we have to create the conditions that allow people to be healthy. And these are some of the things we talk about at the health department when we think about what is really a healthy community. So a clean and safe environment. And safety means a lot of things. It means reducing people's exposures to things that are dangerous in the air and the water. It means paying attention to housing conditions, which can, as you all know, exacerbate illnesses like asthma, but also create conditions that allow children to get poisoned, and also can contribute to high rates of injury. A healthy community is a community that has had an economic investment. There has to be meaningful work and job opportunities and opportunities for business and residents. Healthy communities have infrastructure. In Boston, we're lucky because the infrastructure is not just resting on sort of city-run services. It's not just our schools, not just our libraries, and it's not just our community centers. In Boston, we're really lucky because it's also our community-based organizations and all of the work that they do to contribute and build an infrastructure. It's our churches. That's what we talk about, having a really stable and steady presence that creates in the community opportunities for people to both work together, but also access the kinds of services and supports that they need to be healthy. There have to be opportunities to adopt a healthy lifestyle. So here's where, traditional public health and what I like to call, the current focus of public health really have diverged. In the past, we thought it was our job as public health practitioners to make sure that people had the information they needed to make a healthy choice. So we needed to tell people how to eat right. We needed to tell people that it was important to exercise. But really, what we're talking about now is we need to make sure that people have the conditions around them that allow them to exercise, and the conditions around them that allow them to have access to affordable, fresh, and healthy food. It's no good to tell somebody to eat healthy food if there's no supermarket nearby that carries produce, if the produce that is nearby is of poor quality, or if the food that's healthy is priced so high that it's cheaper to eat junk food than it is to eat healthy food. Because people on a limited income cannot compensate for all of those barriers to having a healthy diet. So even if they want to eat healthy, if we make it too difficult, people can't do it. So there's no point in telling them that that's their job. We need to create the conditions that make it possible for people to have that healthy diet. The same thing around exercise. You can tell people how important it is to be physically active, but if you live in a neighborhood where you feel like it's not safe for you to go outside or for your children to go outside, then it's much easier and safer in your mind for yourself and your children in particular to stay inside and watch TV or be on the computer. Those are not bad options if you feel like the outdoor environment isn't going to be safe. Also, if you're working 2 jobs, when are you going to get your physical activity unless there's workplace initiatives? And if you don't have money and all the recreational opportunities around you cost money, then again, your options are limited. So making sure that people have safe places to get physical activity and affordable places is a huge part of this sort of access to opportunities to adopt a healthy lifestyle. We also say, it is important to have access to health services and human services and social services. And I'm not trying to diminish that. It's just oftentimes when we talk about what contributes to a healthy community, this is the only thing people want to talk about. Is, can I get to the doctor? Do I have a doctor? Do I have good hospitals? Am I going to get care? Where can I get care? Is my care affordable? And that's just one piece for us in terms of assuring that the community is healthy. And last, I want to talk a little about social capital, because I think this is, we often don't think about social capital. I don't know how people define it. I like to think about it as the, sort of what happens in a community around the strength that you have when people can work together and work together well. So there might be other more formal definitions, but for me it's really about being able to build relationships that actually allow the residents in a given community to be empowered to make decisions and take control over the things that are important to them. And I call that social capital. And the ability for people to work with each other is something, again, that we can support or we can hinder. So for me, these are what we need to focus on as a health department, is making sure we've got all of these attributes present to